Hello ladies, as you know we are doing Boobie June, SeaGals and BounceDown. So this morning Tara and I have come into BCRC to meet Karen to talk about all the wonderful things that they do here.
The first question that I wanted to ask is, what does BCRC WA do?
So BCRC WA, so the Breast Cancer Research Centre WA, it's a not-for-profit organisation that was founded back in 2009. We basically offer evidence-based treatments for patients undergoing breast cancer therapies. We provide support to them and their families. We've got access to a variety of different surgeons, medical oncologists. We've got a team of nurses, a research department. We've got access to genetics as well too.
What is your role as a breast nurse?
Yes, so I'm one of the early breast cancer nurses here, so we've got a whole host of us here as well, but I suppose my role is that of a supportive role as well as like an administrative behind the scenes. So what we can offer is that if our patients who are undergoing treatment, we will meet with them, explain to them the lay of the land, what the treatment will look like, things to look out for as well, side effects, what to do when things go wrong, how to get back in touch with us or then into their hospital should they need it. We also check in with them, make sure that they're feeling supported and that things are being addressed. We can offer them advice on how to engage with local services as well as BCRC services. It's just making sure that they get access to everything that they need. And then as well as that, we also offer patient support groups. So we've got the PINKS, which is our advanced cancer and breast cancer support group, as well as then the Pink Collective, which was just founded at the beginning of the year in January. So that's for the early breast cancer patients. And yeah, it's basically just trying to make sure that we're offering a pretty well-rounded service for them and helping them get through this journey. So generally how the patients will come through would be via most likely either GP or surgeon's practice initially after having found a symptom that warrants them coming for these services. And then they are seen by their doctors. We have our offices where we can chat with them as well. We can meet them on the ward and the day ward as well too, where they're receiving their treatment. And then within the BCRC suites here on level 3 in the consulting centre, we've got ones for the surgeons, we've got some for our counsellors as well, we've got the research team here, so we're pretty much all on the same level here, so it's a really good well-rounded service.
If someone was going to their GP and then had some symptoms and thought, okay, and I'm going to go get a test, do they need to, is it an automatic thing that clients get funneled through to BCRC, or is it an opt-in?
It could be an opt-in. I suppose the GPs can refer to the team that they know who are here, but we've also got the breast clinic as well, so you don't need a GP referral to access that. You can self-refer, so just by ringing up, it's on our website at BCRC, if you go on and you can make an appointment then by just getting in contact with the room. So it's a really good way to, if you feel like anything is untoward or different for you, just to be able to pick up the phone and not be waiting on GP appointments as well.
Are there any myths out there that you hear about that you want to debunk and just let women know that no, that's not the case?
I think one of the myths would more so be for male breast cancer as well. So you don't, the biggest risk of it getting breast cancer is by having breast tissue, I suppose. So men can get it as well as women. So just making sure that across the board that everybody is a bit more breast aware.
I went for my first breast check at Christmas time.
Great.
I'm older than 45 and I always thought that maybe you had to be that sort of age to go and get your breast checked. So is that the case, or can you go younger, or what do you advise?
So yeah, there's many ways to get checked. I suppose that yes, you're correct in terms of the breast screening that it's at 45, and you can opt in a bit earlier than that, around the 40 age mark, to get your screening done through that mode. But I think it's just about stressing the importance of being breast aware yourself. So we have a great opportunity to be able to perform breast exams on ourselves, in the shower, or at regular intervals. So pick the first of the month, for example, as well. It's a good time to kind of have a feel and see if then between the 1st of May and the 1st of June that there was a change in that time. So it's just about being aware of your own normal. There's also other factors then to take into play, like your family history, your own risk, if you are someone who carries a genetic mutation. So that would be something to talk about with your GP or your healthcare provider of choice, that you then identify yourself individually based on your own risk. Are there any other screening things that we should be looking into for me before I reach that age? But I would say just with your own body as well, being in tune and reporting any changes to your medical provider is the best thing to do.
Yeah.